Hello, my name is Matthew Lunsford. Today we're going to be discussing the work of Dr. Corolla Dillenburger Keenan. Who is Corolla Dillenburger Keenan? Dr. Dillenburger Keenan is a behavior analyst, practices applied behavior analysis, conducts research at Queen's College in Belfast, Ireland. She began her work in behavior analysis starting in October 1993 at Queen's College and is still active today. What and who is the focus of Dillenburger Keenan's work? The main focus of her work centers around the following objectives. 1. Understanding humans with autism spectrum disorder, which includes how they interact with the world and how people need to interact with them to include best clinical practices and best treatment outcomes, how to assist and understand the teachers and family members of individuals with ASD, and advocacy to increase awareness of the realities surrounding an ASD diagnosis. How has Dillenburger Keenan contributed to the ABA literature? Dillenburger Keenan's contributions to ABA literature included the clinical treatment of ASD, how to train and educate caregivers, including teachers, parents, etc., and ensuring that behavior analysts are fully educated on the clinical scope of what an ASD diagnosis entails and how to properly care for their ASD patients in the ABA setting. Mock interview summary. My questions focused on the following main points. What direction is the field of ABA headed and why? As we've seen, at least in Virginia, there's been expansion of ABA to include us among the definition of mental health professionals, which is technically physicians. What is the importance of understanding the psychological impact of ABA treatment for clinicians? As you know, ABA does not generally embrace clinical psychology. However, I think that as clinicians, we should be educated in both, where we can understand the emotional impact of treatment on teachers, caregivers, and their patients. And lastly, would ABA benefit from an expanded scope of practice to include diagnosis and use of other forms of behavioral therapy? Personally, I think we should be able to at least diagnose autism and some behavioral disorders. We are clinicians after all, and I think expanding the scope of practice beyond just ABA would be extremely helpful, be able to reach more clients and provide better treatment options for those who have used psychotherapy and had it not be as successful as they would have liked. What are the implications of Dillenburger Keenan's work? Dillenburger Keenan's work suggests a couple of things. The effects of ABA treatment on caregivers and patients would be better understood. As clinicians, we need to understand how the treatment we're giving is impacting those around us, especially the patients and the caregivers. And the clinical scope of practice for ABA may evolve as we begin to understand the clinical benefits of ABA and the full extent of its applications. Compared to things like psychoanalysis or CBT, ABA is relatively new, so we don't have a full understanding of its full benefits, and all of its applications. I think over the next 5 to 10 years, what we'll be able to do with ABA and what we'll be allowed to do with ABA is going to greatly expand. Lastly, here are my references. Rather than include my references in the main body of the presentation, I decided to include them here. As you can see, I used most of the work related to school, as that is the main focus of Dillenburger Keenan's work. However, as you'll see, she also has some articles out on ASD itself and how parents and caregivers perceive ABA and the experiences of living with autistic individuals. More references. And that concludes my presentation. Thank you for watching.